Thanks, everyone, for joining us today. I'm Joel Tyson, and I'm the president and CEO of Homespire, a new company that Intermountain has built up here, and we're really excited to tell you more about that today. The first thing I wanted to share with you is really the why behind this new entity. And I think a lot of us that have been doing healthcare and services to seniors over the years have really seen that there's a real broken experience for folks. I think we're really good at solving their acute reactive sort of service needs, but serving them long term and creating great outcomes and really inspiring them and creating the healthiest lives possible, which is our mission, has been more of a challenge out in the community. And so what we're really doing here with Homespire is filling some of those gaps. What Intermountain did was originally they went out and said, look, we're not really solid in this area, so let's go find a partner. And this is really a joint venture between a company that I've started actually in Minnesota called LifeSpark and Intermountain. And that's really what's made up this joint venture. And Intermountain was really looking for the best in breed, the company that could provide the best non-medical services out in the country, home health aides and 3 to 24-hour care, et cetera. And what they found in LifeSpark and in our passion and vision was really what was underpinning, all the same values that Intermountain hold, which is around that healthiest life possible, and found that working with people more holistically and more completely was an opportunity that really could expand this vision even more. And that's really what we've done and what we've created in Homespire. The vision and the experience that we see is this Betty's current experience. And again, all of us have seen this with a lot of clients that we serve, where on the left is the health status over time, and what happens to people like Betty is they're independent, they're doing fine, something maybe psychosocially will happen, and they'll end up, maybe stop taking their medications or stop eating well, and they end up getting dizzy and having a fall or a crisis and a hospitalization. We're really good at rehabbing them and fixing the hip, and then we get to a point where our payment model serves them to a point, and then we discharge them, and they're out on their own again. And what happens is they might plateau, but then again, some of those root cause creep back in, and maybe they're still lonely or something wasn't solved in the first place, and they end up having another slide down that slope to another crisis. And over 2 or 3 of these, you can see this roller coaster of healthcare crisis, which is this readmission rates that we know that are very prevalent with this population, and overall not a real thoughtful long-term approach. So this is really our enemy, this current experience, and what we're looking to break in this model that we've developed together.
Imagine a senior care company that discovers the whole person, one that considers what seniors need, what they want, who they are, one that works to reduce the need for caregiving services. Imagine a proactive approach that goes beyond the traditional home care model to transform care for seniors, providers, and families, and inspires everyone. What if home care was life care? Would that make a difference? At Intermountain Healthcare, we know it would, and we're making it a reality.
This is about One Intermountain and our commitment to help people in our communities live the healthiest lives possible. It's going to take all of us working together to change the experience of aging, and that's why we're launching Homespire.
One of the most important things about Homespire that I want everybody to realize is that this is about a whole new model. And what this new venture does is it creates a trusting relationship around the client, involves the family, involves the community, and looks to really discover the passions and the gifts of that person long term and create a wellness platform.
Traditionally, senior care has often involved a reactive approach with a focus on crisis management. Each health crisis and life challenge takes a toll, resulting in rehospitalizations, loss of independence, and decline. Current options for private pay home care don't go far enough to coordinate care, support family caregiving, or eliminate stress. Something's missing. Homespire, a new company and joint venture with LifeSpark, delivers on the world-class whole-person model of private pay home care and helps seniors thrive wherever they call home and whatever their life situation happens to be. Homespire transforms the entire care experience for families, caregivers, and communities. It works with every aspect of Intermountain Healthcare or any other service to provide a seamless experience to help seniors remain in their homes longer and live healthier, more independent lives. Homespire is an Intermountain company that provides all the private pay home care services you expect. Home health aides, homemakers, live-in caregivers. But it goes much further. To eliminate the roller coaster of healthcare crises, Homespire brings the critical difference, the Life Care Manager. Every Homespire client gets assigned a dedicated registered nurse Life Care Manager who gets to know each senior's unique needs and works side by side with them to help identify their goals for a richer, more fulfilling, more purposeful life.
With the ongoing support and coaching that Homespire offers, I believe more people will be able to stay in their homes and their loved ones will be able to have the satisfaction of knowing that they're able to meet their needs and they don't have to do it on their own.
Homespire uses a person-centric model to work closely with each client and family to develop a life plan across all elements of well-being. It starts with a free, no-obligation discovery consultation to create a customized vision that goes beyond the senior's healthcare needs to nurture their purpose, passion, and identity. The Life Care Manager then provides regular in-home visits, phone support, and continuity of care across all settings to realize that vision.
Now with Homespire as an Intermountain healthcare service, we can provide better continuity deeper into the community for the patients we serve.
We know that every crisis avoided and hospitalization prevented not only increases people's quality of life, but also decreases their overall healthcare cost.
With Homespire, the communities we serve will benefit from our innovative, holistic approach that closes gaps in care and reduces costs. Families are able to spend more time together and get guidance through challenging issues. It helps them live a more balanced life with coordinated support that gives them confidence and peace of mind in serving their loved ones. Best of all, with Homespire, seniors are able to live the healthiest, most independent, most inspired life possible through a home care model designed specifically to care for their entire being.
I'm excited to be working with all of you to further improve the client experience for our seniors and families. This is an incredible opportunity to live our Intermountain mission by adding whole person senior care to our system.
What my expectation is that we're going to change the world. We're going to show the world that by providing whole person senior care long term is going to be the right model for all people.
Welcome to Homespire. For more information, visit www.homespirehealth.com.
So this slide represents the model that we're delivering at Homespire. It all starts with culture and people, having the very best people, the best caregivers, the best nurses, the best social workers, the best people in the model, to ultimately getting at that with the model, which is our life management process. You know, what we like to do is discover and not just assess, but discover with them a whole person approach. We prioritize that. We create life plans, and then we ultimately deliver on those. So it's not just creating a plan, it's helping them getting that delivery and fulfillment in the community, and then ultimately measuring that and making sure that our accountability to the client, to the family, and ultimately to the health system in general and to our major payers is being also represented. And ultimately we get that proven whole person senior care experience. This is the model where we look at that whole person. It gives you more example. I'm not going to read this slide. You can look at that in the sense of the individual aspects of each of these areas. But it truly is taking the psychosocial and blending that with the medical. It's not one or the other, and that's where we are different. Is we're blending the two together to create awareness and discovery, and ultimately value to each individual. You know, that person-centric approach to the model.
And this is Karen Carney. I'm the Vice President of Marketing and Communications for LifeSpark, who's working with Intermountain Healthcare on this Homespire joint venture, and met with many of you during the fall to talk about plans for launching Homespire. And what I heard from a lot of you are the social determinants of health, the importance of purpose and passion and identity. And those things, there's a growing body of research that's showing how important those are to really achieving well-being and good outcomes for people?
Yeah, the main difference with this model is that whole person approach, and how we deliver that is through what we call life care management. It's a nurse that's really that trusted advisor that builds that trust. And until you have that trust, it's really hard to discover what people's purpose and passion and have a real deep conversation with people. So where we look at, how do we develop that long-term relationship, not just a short-term episodic or transaction, but a real experience over a long period of time. And they are really the main differentiation in the model. Ultimately, what that produces is outcomes. We have a history here where we're able to reduce hospitalizations, as you can see. We reduce ER and emergency room and emergency department episodes, because there is that key component, that trust and that relationship, where it avoids a lot of that unnecessary hospitalization. And ultimately, as you can see as well, we look at those social determinants and measure those with every client, so we know that we're creating the value that is entrusted to us.
So the services that are provided are many of the ones that you would normally expect from a private pay home care. Caregivers, homemakers, live-ins, a wide spectrum of capabilities, helping people with activities of daily living. But again, using that model with the life care manager at the heart of it. So all the reasons that you would have expected to use private pay home care services in the past still are there, and we have all those services with the addition, and this is actually a component that's not really been available in Utah before, that life care manager bringing that higher level of care in the community to folks. So what that means to you in your roles, various roles throughout Intermountain Healthcare System, is the first is this is giving you added support in the community to implement that shared plan of care. It's also help that you have in the home, eyes and ears, to help connect and coordinate services so that you know that the clients and families are getting the best that they can to thrive at home. For our clients and families, what that means is that they are getting extraordinary care and guidance. They're getting a higher level of that coaching and support to live the healthiest, most independent lives possible. Using that whole person model that's actually going to work to reduce their need for care, which lowers the costs, improves their outcomes. And for many families, we know that while they might want to care for their older loved one, they need support sometimes juggling those efforts, and all backed by 100% satisfaction guarantee from Homespire. I do want to share with you, so we are launching May 1st, so that's when we're going to start to take our first client, so that's exciting. And you might be wondering, okay, so where are you going to serve? To launch initially and to ensure that we grow thoughtfully, we're starting with the Salt Lake Valley. So we're going to start there, and then we'll quickly expand to serve all of the Wasatch Front, and then a plan then will be put in place to serve all of the Intermountain Healthcare service area so that we're serving, and we're in every area where we're serving clients and families. When might you consider Homespire? As I mentioned with our services, in the same areas that you might use other homemaker and private pay services. So those common issues, when you see a client who has increasing hospitalizations and ER visits, when they have a new diagnosis or maybe an exacerbation of an existing one, maybe their family caregiver is overwhelmed, all of those would be great times to call Homespire. But in addition, because of our proactive model, we can bring those capabilities such as helping people focus on how they can stay living independently and prevent healthcare issues or prevent social isolation. So there's a lot more opportunities to call us than you might imagine. And we have many clients in our experience who are just using that proactive life care manager. And so it can be a very affordable service in that way. So that leads to some of the common questions you might have. One is the obvious. How are these services paid for? It is a private pay service, as we mentioned, and it's also covered many times by long-term care insurance policies. We will have competitive pricing, and while we'll be in sync or competitive with what exists out there in the market today, we're actually bringing that higher level model with a very competitive price that looks at working to reduce people's need for care. So that's a big part when we think about costs overall. It's the total cost. So Homespire will really be working with every client as much as possible to reduce their need for care, which lowers their costs and improves their well-being. In addition, I would say just call us. If you have questions about whether someone might need services or whether it's going to work for them, call us and say, yes, we'll do it. Know you're going to have questions about choice, about does this duplicate other Intermountain services? Of course, we're not going to, but we're going to go into more depth on that. Is this just for seniors? Another good question. I'll encourage you to check out our webpage. It's www.homespirehealth.com/IH team. Check that out. We're going to have many more of those FAQs. We're also setting up a lot of launch meetings with many of you, so you'll have that opportunity to ask us those questions in person. You can email us at discover@homespirehealth.com. And you'll start to see when you want to start to refer, the next step is easy. We've talked to a lot of people to kind of make that process easier. You'll be able to find it in iCentra. You'll be able to find Homespire Health starting April 1, so don't look too soon, but April 1 you'll see it, and we'll start taking those clients May 1. In NaviHealth, for those of you using NaviHealth, it'll start April 1, you'll find it. And then, of course, call us directly at Homespire. I want to come back for a moment to the question of the integration of Homespire with Intermountain Care Management, because that's a question that comes up a lot. And we've been working very closely with Enterprise Care Management to ensure that we have clear pathways for working together and collaborating. And so I just want to walk through the bullets on this slide for a moment. The first is, anytime someone identifies the need for Homespire, that care manager who might be involved can just make the referral, however works best. Now, those referrals don't always have to come from an Intermountain Care Manager, but when they do, what we'll do is coordinate then with the care manager based on what's going on with the client. So the Homespire Life Care Manager will talk with the Intermountain Care Manager on the goals of care, the plan of care, what's going on with the client, what are the priorities, and then coordinate who will lead those services in the near term. And they'll also coordinate how often they'll collaborate, how often they'll talk, what kinds of information they'll share. That will all be set up. So, for example, if you have a client coming out of a clinic who has a lot of acute care needs going on, it makes sense for the Intermountain Ambulatory Care Manager to manage and really be the lead on that. And the Homespire Life Care Manager then would implement and help implement and reinforce the plan of care, the education, and other things that are needed in the home. And again, they would coordinate the frequency and the types of communication. Now, one thing we'll do for all referrals, Homespire will always check out whether a client who gets referred to us has any involvement by Intermountain Care Management in any way. So, for example, sometimes clients might come to us from a neighbor, from a friend, someone out in the community, and not necessarily from within the Intermountain Healthcare network. And so we'll always call to check and see whether there's a care manager assigned to this client so that we can coordinate care with them. And so that way, we'll always be working together with Homespire being in the home, helping to reinforce plans of care for care management and for any other Intermountain healthcare provider, and working that plan and creating the better experience and better outcomes for our mutually served clients. I hope that answers that question. If you still have questions about that, as we mentioned, that we're setting up some launch meetings, and you'll have some opportunities during those to ask more questions. We're going to wrap it up for today, and I just want to thank all of you for spending a few minutes with us to learn about Homespire and the addition of this service to the One Intermountain Continuum. We know that together we will change the experience of aging. So thank you.